questions about it. Second, we need to make sure all of our first responders have access to the overdose treatment Narcan needed to respond to this epidemic. That's why I introduced bipartisan legislation to protect from a lawsuit our first responders and others who administer Narcan. About 30 states now have this as their state policy. We need a national law. If you're a family member, someone is desperate, you're afraid that they're going to OD, no one in your family and no friend should be afraid that they can administer the Narcan. There's almost a 100% guarantee you'll save that person's life if you administer it. We have to give immunity to anyone who does that as a private citizen, and we need it as a national law. Third, we need to expand treatment and recovery efforts that work. Nationally, 4 million people are abusing prescription drugs. Say that again. 4 million people are abusing prescription drugs or heroin, while 50% need treatment but are not getting it. Here in Massachusetts, approximately 65,000 people are currently dependent on opioids. 50,000 need treatment but aren't receiving it. I'll give you the number again. 65,000 people are currently dependent on opioids. 50,000 need treatment but aren't currently getting it. We have to dramatically increase the federal budget to help the states to deal with this issue. We need to have the beds for the people who need this help. Treatment for prescription drugs and heroin addiction should not be harder to access than the actual drugs destroying their lives. And that's why I introduced the Treatment and Recovery Investment Act, which will increase funding for states so that they can better treat those suffering from substance abuse disorder, including pregnant or parenting women and adolescents. I introduced that bill with Rand Paul from Kentucky. It's got to be bipartisan. We have to work together. And I've also introduced legislation that will help ensure that released inmates have the coverage they need to get treatment when they re-enter the community. Nearly 85% of prisoners in the United States either have a prior or present substance abuse disorder or committed a crime that was related to substance use. Hear that again? 85% of all prisoners. While many of these individuals return to their community after incarceration, their ability to access coverage is severely limited because many states cancel their Medicaid coverage. They're poor. They need Medicaid. They're in prison. Cancellation of their Medicaid benefit harms them because when they leave the prison, they've been detoxified, and now you're putting them back out on the street. Where's the money for the treatment for these people if they're going to go straight, if they're going to be able to make it? We have to be smart about this. You're punishing yourself as a society when you think you're still punishing these people as though it's a character weakness instead of an illness. So we have to solve that problem. In this state, Peter Katush and Steve Tompkins are really the leaders. They are absolutely fantastic. And I see Rachel Kaprelian right here. We're so fortunate to have her as the regional head of HHS. So all of that has to be solved as well. We know there's no one silver bullet, but we do know that we have to act across state lines. One final thing. PDMPs, prescription drug monitoring programs. When someone gets a prescription in one state, that state has a system that says, here's the history of this person with this drug, but the next state doesn't have access to that. If you're going to then cross right over the state line from Westport, Massachusetts, then make a quick drive over to West Warwick, Rhode Island for a second prescription, no guarantee anyone's going to know across the state line. Lawrence to Manchester, New Hampshire, Holyoke up to Vermont. Tom Quinn, he's the Bristol County DA. He's here this morning. He's got to have the tools to know what's going on across state lines. We need a national prescription drug monitoring program which is interoperable and mandatory. No matter where you move, as you try to buy these new drugs, your record is going to follow you. You're not going to be able to escape the information which is going to be necessary for the medical personnel that you are talking to ask you the important questions about where you are getting your drugs and why you need an extra prescription. And that's why ultimately we need to ensure that we implement the mental health parity parts of the Affordable Care Act. The insurance industry nationally has to be made accountable. We have to ensure that it is enforced and it is given the tools which it needs in order to be able to provide the help for these people who need it. Patrick Kennedy, Ted Kennedy, huge leaders on this issue. But we have to make sure that there is teeth in that law. We have to make sure that the insurance industry gives the help to these people who need it. So this is the time, this is the place, I think Massachusetts and New Hampshire are the places that have to put together a comprehensive plan, but we have to implement it nationally. And it's got to be bipartisan, and it's got to be now, and it's got to be funded, and it's got to be much more aggressive than best practices, or try to do your best, or here's some money for a study. No, we're past that already. The evidence is already compelling, and we need to do what we know we need to do as a moral responsibility. So I married a doctor who was a behavioral, she was the chief of behavioral medicine at the National Institutes of Health when I met her 30 years ago. She's been talking to me for 30 years about the stigmatization of mental health, mental illness, and the stigmatization of addiction to drugs. It's not a new issue. It's just new to the suburbs. It's new to every family. But the problem has always been out there. And the time now is to act legislatively, to put real teeth into the laws of our country, to create the funding, the treatment, and the enforcement that is necessary to make sure that we deal with this problem. Thank you to Jim Brett. Thank you to the New England Council. Thank you all so much for being here. Thank you for having us.
Well done, Senator.